Thank you. Good afternoon, everyone. And obviously, I'm seeing everyone here a little bit earlier than anticipated. As you've likely heard, Nunavut has its first presumptive case of COVID-19. An out-of-territory worker at the Mary River mine has tested positive twice on site. And while we await the confirmed results from a lab in the south, we have to treat this as presumptive. I'll let Dr. Patterson speak to the specifics of what a presumptive case means, but I want to reassure all Nunavut that this is a very isolated case. This individual has had no contact with any Nunavut. Mary River is not accessible by the surrounding communities at the moment, and there are no Nunavut residents working at the mine at this time. So there is no need to worry about the spread of COVID-19 in this incidence. I would like to take the time to wish this individual a speedy recovery, and we are working closely with Baffinland to make sure that they have the support and guidance that they need. Thank you.
Unusakut tabbani takusaqaidiumi jatsiiniriulaung Iqaluaratta takunasaahattalangalayugalawaratta tusarsimalertutsaugatsi Nunavutmi sivulleqaami pasagiyaujumik nuvatjuarnaq 19 qarneqartaulertuq taana Nunavutmi utaungittuq eqqanaayaqti nuluuyaani ujaranniarbimmi taana nuvatjuarnaqtuqarningani qauyisartauningani maqquarti naluneertaussimalertuq Sulinaluneertaullarilaunginninginni qallunaani qauyisarbimmik tamanna pasagiyauninganik naluneersimagialivu Lutta Patterson uqaulemaaussiqallangajoqqaanuqtaakua tukiqallarimmangata pasagiyauningit nuvatjuarnartuqarninginnut kisiani naluneerbigiyumajakka Nunavutmiulimaat taanna tuuninganik sulle taanna pasagiyaujortali nuvatjuarnartuqarninganik katisilaorsimangittoq Nunavutmiunik Nulujaanlo taanna upattaugunnaqani qanigiyanginnu nunalinnu maannaujoq Nunavutmiunik iqqanaayartuqanngittuujararniarbimmi maannaujoq ammalu isumaaluttuqariaqangi tamanna siarmagajarninganik nuvatjuarnaq 19 taanna pasagiyaui nuvatjuarnartuqarningani qanuigunniitsautigirujavut pileriqatigitsiartavullu ujararniartikku Baffinland taikku ikajorsortautsiaqhullugit ammalu atuagarni maligiaqaqullugit
Good afternoon. Today we announced that a presumptive test result of COVID-19 has been detected within the Mary River mine, 176 kilometers southwest of Pond Inlet. The individual who tested positive recently arrived in the territory for work and was tested twice at the mine site. The tests yielded presumptive positive results on back-to-back days. Additional swabs will be taken from the mine worker and sent to Southern Labs for verification. We anticipate that these results will be available early next week. Until then, this is being classified as a probable case of COVID-19 for Nunavut. If the additional testing yields a positive result, this will be considered Nunavut's first confirmed case of COVID-19.
Unusakut ullumi naluneersivugut pasagiyaujorarninganik qauyisartaussimayumik nuvatjuarnaq 19 qarninganik tappaani nuluyaani ujararniarbingani ungasinnilik 176 kilometernik nigiata pingannanganip mitsimataliu taanna qauyisartauloorsuni naluneertau qataaloortuq tikirqataartumini Nunavutmut iqqanaayariarsuni maqquatussuni luujararniarbimmi qauyisartaussimayo qauyisartaugutingit taima nuvatjuarnartuqarninganik maqquarti quliriila qaulaortillugu qauyisartauqannanga taima nuvatjuarnartuqarsuriauju taakkualu qauyisartaugutitsakkanniit aullartitauniartu tabbanga ujararniartimiingaarsimajunik qallunaanu naluneertautsiakanniqullugit niriuttugu tamakkua qauyigutaujut atuinnaulaartu pilasuarusiulaartu pigiangarningani taima tikilaunginitsinni tamanna naluneertausimaniartu pasagiyautuinnarninganik nuvatjuarnaq 19 qarninganik Nunavutmi taakkua qaakkanningajuk qauyisaqutaujut naluneertaupata nuvatjuarnartuqarninganik taana naluneertaugajartoq Nunavutmi sivulleqpaami naluneertaussimaninganik nuvatjuarnaq 19 qarninganik
At this point, there is no evidence that any Nunavummiut are at risk for exposure. The individual is currently doing well and has been placed in isolation. All potential contacts within the mine site are being identified and placed in isolation, and no contact has occurred between Mary River workers and any of the surrounding communities. The Department of Health is closely monitoring this situation and will be providing support if and when necessary. We are confident that all necessary precautions have been taken to minimize, to the greatest possible extent, the risk posed to Nunavut. The risk of transmission to other workers at the mine site is also low.
Manayok naluna taw si mayo hangitok Nunavut miunik uluga nak tumito hamning gigianganik tay magsang magbiu gayang ningini. Tana kanuingin nakaktaw yok amalo inutu titaw yok aniteli titaw luni. Tako katituin na kaya liminingit uyang na bimmi naluna yak taw yok amalo inutu giyahak titaw laktuting. Tako katisilaw sumangitut nulu yanik kanayak tiit amalo hanigiyangin nito nunali. Anna hamnang itulirikut kawisat siyangin na palyayo tamatuminga amalo ikayok suilang ayo ikayok tau gakakata. Nalungit tigut tamakwa sibong agut ujaksut siya kutiu simayo tamanna. Bikon nang nilimangigut uluka anak tumili kunagit siya makbigon nang ningin nunavumiyon. Uluka anak ninga siya makun nang ninga tatamak kunung asingin kanayak tinut mana apasito.
This presumptive result does not impact Nunavut's path or any of the current public health measures in place. I have informed my colleague, the Chief Public Health Officer of the Northwest Territories, and at this time this does not impact travel through the common travel area between Nunavut and the Northwest Territories. This will also not impact medical travel bubble established with Churchill. The Government of Nunavut will monitor the situation very closely and updates will be provided as information is made available.
Tana pasagiyaw yok sakiro taw yuminak atoy na kadyang itok Nunavut mi kasuyaw valyaning inot matuyok palyagon nak ning inot ubalo ni manaw yok anahang nang ituliri nang mumalik taw kakti taw yun. Tusakti si mayakap day mapiliri yaw katinga anahang nang ituliri nang mo angayok ka nga nunat siyami. Isa malayo katigit si mayo taman na atoy na kadyang itok aw lakat takon nak nang Nunavut nunat siyang mulo. Taman na ito'y nakadjangin medyo na beli ato ti aw lahat taktunod ang ikataw sa mayunod kudyo akalok church mo. Nunavut ka pa makungi kawisak paliat siyangin na niya ato tamatumunga ang malo to saktit siga hatak niya ato to sakat siya ito ato'y naulakay pata.
Though this probable case may not impact the health measures in place within Nunavut, this is a stark reminder that COVID-19 is still a very real threat. The pandemic is not over, and no combination of preventative health measures is 100% effective at keeping COVID-19 out of the territory. I urge Nunavut to take this reminder seriously, continue to practice preventative measures that we have become accustomed to, wash your hands, practice social distancing, stay home when you are sick, and be kind to one another. Thank you.
Tana pasagiyaw yok ato'y nakadjang ito anaham na tulari ng balik taw kaktaw si mayunik Nunavut. Kasi ani sumalod na ito ni ikay sigot yubok nubadyo anak 19 tana uluka anak tulari yun ngani. Taman na siya mapalianik nunat jami anigok ni usang ngimat suli. Tamak ko isot ila nubadyo anak tatay ulitit sinak mo 100% mitay ma nubadyo anak 19 mi Nunavut mo tikitay ulitit tayo kung nadya laungin mata. Ayaw to kaya kaka Nunavut taman na ikaitit sigo tayo yok isumalo giyaw hulugo. Suli ato ti kay naritsi tayo masaya maktitsi tayo linang mutat kwa kaya mayay nakilak tabo. Agkasiwasay naklugit inukatigi kanilo at tayo lahat talutik. Ang ikasama katalusi kani magaygot si amalo tungganay nakatalusi. Kuyan na may.
Ken Driscoll, APTN National News. Dr. Patterson, what's the testing and medical capability at the Miriam River mine site?
Ken Driscoll, APTN, kunik luta Patterson, kanu tigitay ko akaw yung sakot ako nakatapani o yakang nabim mi bafen lami.
I'll break it up into two parts, testing first. So the testing is the PCR lab-based test. It's not the near care or point of care devices like what we have here at Iqaluit, but it's has not gone through the rigorous checks that would be required for that the public health labs in the south have gone through. And so that's why the lab testing results from from the Mary River can only be considered presumptive, and we can't call it confirmed until it's been tested at a public health lab in the south that has gone through that accreditation.
Atihat PCR miktaku nunga haya sakta gutingit lalo na yakta gun nangin mata tamane kalon nito tito lalo na silo akong nangin mata tay malo ta ko haya sakta utsak si mangin mata makatang nang ikalo ang mga tay matsay na nang ituloy ng mga activity to kallo na ni tay may mata na nuluya ni pasagayaw na kaktaw to inaktok suli lalo na yakta ulawin nga ni kallo na ni ta na ilisagayaw si mayo mo haya sakon na siya ni kallo na haya saktin.
The medical capability is, my understanding is it varies a little bit based on their schedules, but it's usually either physician's assistants or advanced care paramedics who can do, they're there to stabilize people when they have injuries and get them ready for transport to the south, QGH or further south if needed. And they have got some extra training on contact tracing and will assist them with that as well. And they have separate medical directors on standby to give advice to the physician's assistants or paramedics as needed.
Takwa inulisay ko na ng muta tapi kani atuin nakagalatu galuat kasi ani takwa luta no ikayok tituin nak ambalo to agang naktuliriji tay ma kani aulak titaw gya kakayak anak to kakaulak titaw yo hak nak tilugo upalungay jay jituin nay tamaw hikit tani anak balo mo kalunano luni aulak titaw gya hak to kakat ilinak si matsari luti kikun ni katitakak si mamanga kaya sa kuna ng mot ikayok na tabuta matimunga ang malo ato yung nakatsiyak tigo takunin ikayok akong nakun ikayok tawag kata.
Has the health department sent anyone or any assets to Mary River to help out with this? And if not, at what point would you consider doing that?
Takwa na hamnang itulirik ko aulaktit si simavanulu yano ikayok ang naktunik ko balo aulaktit sila ang ipatakangak ko aulaktit si kayakan.
No, we haven't sent any at this point. We would consider sending staff to help out if there's any concerns that there's transmission of COVID-19 happening in the community, or that they're having difficulty with the contact tracing and managing those other public health measures effectively. And so far they do not appear to have any of those difficulties.
Gasuli. Ila sumatsaksi ako takakayak tigo ikayak tawag hakata isumalon nang imaman na ayok tako sa magayak ninginik tako alon ni ayok natukulik kata tamak kuningat katisimayangin ni kaya sakpalyan ng mot ikayok ayak mijabot tayo matuin na hatsak tigo ikayok ayak naktigo kasi ni man na ayok naktigo tuyangin mata ikayok ayak titsidjangit tigo.
Rashni Sharma, Nunavut News. Dr. Patterson, did this individual self-isolate before coming into the territory? If so, where? If not, could you explain the process that is in place for minors to come into the territory?
Rashni Sharma, Nunavut News, kunik luta Patterson, tana tamawa tikilaw kani naminik inututikay na nika ubalo naminik tayo may liok tuni tayo may ningik kunik isuwa to agay tayo may liok mo.
Thanks. Mining is across the country nationally considered one of the industries that's essential, and so the miners have not been required to isolate before they come into Nunavut. What's been happening is that it's strictly staff coming from the south flying directly to the mine site, going to work for their 2 to 4 week rotation, and then returning home. And that way Nunavummiut are not exposed to illness from people coming from the south without isolating first.
Taman kanata miyo jam na tulirin pimayo na kakta matay may mata na minino tugi akalawng itino na vumutikilawngin ng mini may liok si mayuta ko kanayak dito ato nakata to kalonanik o jang nerbin mo makunik sita manilo ni kanayak ato sutik tapangat asi ano nunalin nulaw katik kalonano uti katak tut tay ma Nunavut meu sa marbeu hunagitaw na ngakalunani ngakton.
How many days after entering the territory did this individual exhibit symptoms of COVID-19 and then bring that to bring their situation to the health professionals?
Katsini uluni tana Nunavut mo lauksuni lauk tilugunu wadjang 19 haktumini ngani tay ma nalunak tawlauka.
I don't want to get into too many details for this individual. They still have rights to privacy, but actually this individual is not symptomatic at this time. It was caught as part of their routine screening.
Ta ko ilulingin niyo halaga hangin na mata na pasagi yo yo hak to pidun na te hang ate mat o hausi we hangin ni no kang unak tulirin ang mo ta na hanu igut te hak to ya law ngitok kisani hawi saktaw ngin na hatang at te ma hawi saktaw gayut tilugi te ma hawi yaw lak to mina.
Dr. Patterson, at this time, would you be able to share how many individuals this individual has come into contact with?
Luta Patterson o hakun nakhihat sinita na katita hak simasuri yaw mga.
As of yesterday, it was, I think they had said 12, but that number may change. It may have already changed throughout today. So, yeah, it's at least 12.
Ipatsak 12 muna kaktaw law tuit kasi ani ta nasid zero nangat kasi ani ulit may kawi galang inako kasi ani 12 ni katita hak simana kaktaw suriya.
Just one last question. Where is the swab being sent to confirm the testing?
Oh, namutan na kawi sa kutit sa lak titaw ni kanalo na tayo siya laki hulugo.
To the labs that we use in the south, in the Baffin region, it goes to a lab in Ontario and gets confirmatory testing done there.
Kawi sakbim mo taw na ni kanalo na ni tama na kakik talo may nga to Ontario mo kawi sakbim mo taw hatak to.
Thank you.
Jackie McKay, CBC News. When did your office become aware of this presumptive positive?
Jackie McKay, CBC kunik kano alabi hangak ko kawi ni kataman na tayo mga nalo na tayo gyanga.
About 8 o'clock last night.
Migalaw no sa ulaw te patsa.
Are you able to say where the person came from and how long they've been in the territory?
O kakong nakita na nakingam ng mga malokan o tigino na bumilang mga.
No, sorry, it's their privacy and it's not really, actually, I'll correct that, it doesn't have any impact on the risk that they present to Nunavut, so we will not be discussing those kind of details.
Aga, tayo na ilakan mo natuloy na mo sumalo te kaya hakata taman na lo at yun nakadjangin maulong kaya naktumikan na kutagun ng nanganino na bumiyo no.
At this point, are you planning on changing rules around how the mines are allowed to operate?
Mana yo ta ko ato ga yo malita weli yo na bin no asidjak ne sa lang alakigin.
At this point, our priority is responding to and managing this incident, and if in the process of that we learn things that could help either the mines or Nunavut, protecting all of us, then we'll look at that, but right now it's not our first priority.
Aga yo mana le sivuli jiga hangalang alatatan na kamagibalya logo awla taw sa khulugulo ilikuta singin ninuta ni kaya mangita tinik tamakkuno nga uya na binno nuna vumeunullo luga naktumili khunagit tay masijik siga yakto ko kasi ani mana ya sijik taw yo kajangit taw.
If there becomes a COVID outbreak at this mine and people need to be hospitalized, will they be sent to hospitals in the south or would they come here?
Taman na kadjuan na kapani sa mapalya talim na ka ana bila ka khalerlutik tamaw nga khalunano kaya kad ubalo tamaw nga khalunno.
Depends on the circumstances, depends on how sick they become. QGH is an option for people who have moderate COVID illness but still need to be hospitalized. For individuals with more severe COVID illness or some more severe illness due to COVID infection, we would need to transfer them to the south to a tertiary care hospital.
Tako khanu tigi khani mamanga ta kha yakara ha yaktavu tamani khanu iluangit no khan kisene unit simagalin no tamana khikatane anna balo mo tawga yaktu kisene khani maguti khalo alang nakatanu vadjona mo khallo na no tawga ha yaktu.
And just to be clear, by tertiary care hospital, I mean a hospital with intensive care units and beds available for people who are very sick.
Hakataarama taima khallo na no ga ham nakatamakko ima anne avingaqtunu illilinnu tammalu ippigusut saarunnartunu tamakkununga anne guti khaloartunu.
Is there a concern from you right now about, well, there's no COVID in Iqaluit right now, but if we have to bring somebody in to be hospitalized here, about how that would impact the community?
Ismalo te haqqi tamani no vajjaanartu khaligayangi kaluarmanga tamani anne balamu unitsimagiartortu hariaqattalern neqqanu vajjaanartu talemmi.
There's some concern with that, but we've taken and practiced measures in order to ensure that the risk of transmission to staff either doing the medevac or staff treating the individual at QGH, the risk of transmission would be very small, including having personal protective equipment for the pilots, and there's been nationally, the Public Health Agency of Canada has generated guidelines on how to clean a medevac plane after COVID-19 has been transported in the plane, and staff at QGH have practiced these drills, and we alerted QGH staff last night as soon as we knew that there was a possibility of something happening.
Ilang aguis sumalon naktugal akta ko alo utukaw tiyo si mamata maritaw gali tamakko luga naktumili kunagit surlo hanga tayo kuto avang naktuko titaw sumayo haktilugo balone kikitane anna balome taima ilinak si malangata taman na siya magunar ninga isumalon na loang itok tamakko alo timimot sa pumiyaw gutinik surlo hanga tayo akutingit tamane kanatalima me angit taw si mayunik salom maksay gahang na mo hanga tayo ni kima viula tillugi no vadjo nak to khasuri jaw mo salom maksak taw cha hatalangata amalo ta ko khana yakting riketane anne balom me utugaw ta khatak simaliri ngata amalo khawi kaktaw chaw tigi simalakti ta na pidyo tigi lugo pasagi jaw yo.
My next question is for Minister Hickes. Thank you. Why is the GN not asking or pushing the mining companies to hire Nunavut who are not exposed to COVID-19 instead of bringing people up from the south? Are you considering changing this in the future?
Sumali Nunavut gavamakkungi ajartu jangillat ujarnertini tamani Nunavut miungani iqana yaqartunga hatta khullugi tema nuvajjuana 19 mut katilaw sumangittuni.
We've always promoted, and as well as the mining companies that do operate in Nunavut, always promoted hiring Nunavut in the mine sites. The challenge right now under the COVID-19 situation that we're in right now, there's a lot of concern with having Nunavut go to the mine site, then go back into the community. So to my knowledge, all the operating mines in Nunavut are still paying their Nunavut employees to not go to work right now out of fear of contamination in the community or contagion into the community.
Sakayati sina hatta sumayo tamani Nunavut miuni iqana yati tanga kaswa hatta khullugi ta ko gavamakku tammalo ujarnerti ma natural nakto ko te harata Nunavut nak 19 ta ko Nunavut miut iqana yagarutik ujarner bimmo sai ma sa mak biugutik nunalimin uterutik sa mak tituinara harninginut khawi naksimaluni lutako sulikina jassite tawin nak Nunavut miut iqana yangi kalwaqtillugi taima uluga naktumitit silikhutingin at Nunavut miut sa mak biukhunagi.
I understand that to mitigate risk, they sent all Nunavut home. I'm asking why you haven't pushed for the opposite, why you haven't kept Nunavut at the mines and not allowed Southern workers in instead.
Tanila uluga naktumitit sitaili ng mupidyo tigillugu tay maapirata masumma Nunavut miungani kana yakti khangila hanlo nani miu tamanga tikinga khattangilluti.
I'd have to check with the mining companies, but from what I understand, they wouldn't have enough capacity to be able to do the full rotation with the Nunavut employees.
Tako hauya bigiga haya tako ya na tikut kisane na machiga yang mata kana ya tikit salo ga yang ata tay ma tikit sa khatang ilu Nunavut me to ne kana ya tiksiga sa na khata.
Megan Dooling, Nunatsiaq News. I have a question for Dr. Patterson, please. So can you confirm that every mine worker who comes into Mary River is tested then?
Tana Megan Dooling Nunatsiaq News kun niklu ta Patterson nalo na sikun nakita ko tikin na tulima uyakang na bin no kawi sakta katakalo mangata.
That's correct. Everybody's tested at Baffinland. They're tested on arrival at the site, and then again 4 to 5 days later, and I think they're tested more after that as well, roughly every 5 days if it continues to happen.
Suli yu taman na tako tikin na tulima Baffinland kun no tikigay mata kawi sakta katakto amalo uloy sita matallima ni nagay mata tallima ila kawi sakta katak medyo. And so
the person who's presumed to have COVID-19, they're asymptomatic, so they're staying on site?
That's
correct. At this point, they're isolated on site. They have, excuse me, they've had some facilities set aside since I think sometime in February for isolating people if there were concerns about COVID-19. And so the individual is in that area. All of the isolated individuals are in that area right now.
Suli yo tamako ino tu vitahang ata anik daily view yo me tapa ne o yang na bimmi nalo na sisimalutita na asigin no patawga hangit sumni tay manganik February me pik atu inawlak tu mina isumalo tikhakhunagi taman na nuba jo 19 sa malakhunago tapa no yang na pingani.
How closely did the mine work with your office to develop its COVID-19 protocols?
We've
reviewed them and commented on them, and we've had several discussions over the last couple of months, the most recent one being about 3 weeks ago when they updated their protocols. So of the mines in the territory, Baffinland has probably been the one that I've had the most contact with.
Takusima yavut himikula tavullo uhausit sahabigila usutigulo uhakatigi hatta simayuguta kuninga makuni takhiusima yumni ammalo pinasarusi pingasunasimalaqtutana nutangut kitaugiala mimmatayna parnautinga malittaugia harayartunik tako yaranna bilimanu navummi isumagillugi tako Baffinlaakku pilirikhatiginerpaarisima yavut.
And I understand that this person needs to be tested and it needs to be sent south. Can you confirm that that test has already been sent south?
Tannaila pasagiyo yo khawi saktaminyo yo khalluna no awlaqti tawgia khang khawi sakutaw yo naluna sigunna qiyawlaqti tawgia simalak manga.
Nope. It's supposed to be collected this afternoon. We were having discussions back and forth. One of the, and I shouldn't have put it so flippantly, but one of the reasons that I don't know is we were trying to confirm that the swab that they use in their device is compatible with the swabs that our lab in the south can use. And I know it sounds goofy, but we actually have to keep 2 different supplies of swabs because one is usable by one of the labs in the west, but not the other way around. And so we had to ensure compatibility before we went ahead with it.
Aga. Tainala unnu sanotaw na ila khawi sawqat sami pirsibiw na mga naluna yaqtaw langa yugaloa. Taman na ismalun na galo aktilugo kisana pidju tawlo ato khawi mangin na kata na khawi saktaw gutinga tayma adjigit shara hanga khaluna nito khawi saguti ngata Takwa makbuli nga katak to kawi sa kutiyo yu kima nalo na taw sa matsa kullo kita ko kawi sa kutit say asingin no kawi sa kutin na makatangin mata solo pingan na mi wajing itu ni ato katang kata tayo manalo na si sumagaya kata na matsa kaya kalo mga kawi sa kutin.
But despite this, you're still confident you'll know the results by early next week?
So linalong ila tita ko nalo na taw lang ata kisya ni pinasa ko si ulak tumipigyan ng ngani.
Yeah, if at the end of the day their swab is not compatible with the labs we work with in the south, then we will send them swabs that we use that we know are compatible and then get them shipped back and get it analyzed that way.
Tan nakawi sa kutiyo yu tan na naman ningi pa halo na nakawi sa kutiyo yu mi aulak tit sibiga yakta ba kawi sa kutit sa yakto ni tayo ma aulak tit out sa kutigilo ni halo na ano na matso kayat kini.
Luke Carroll from CKLB Radio in Yellowknife is wondering if there have been any discussions between the government of Nunavut and the government of the Northwest Territories about the travel bubble after the announcement of the presumptive case.
Luke Carroll, CKIB Kugni Yellowknife Minalaw Siri Kugnit Nunavut gava makungi malununat sa gava makungi kakatigila katay maawla katigi katakni kanwing ikalo mga tatan na nalunak tawlok tiluwang kasagiyaw yo.
Not yet. We've had I've sent an email update to my colleague in Northwest Territories, Dr. Candola. Have not heard back yet. My thinking is that where this is an isolated case and it's on Baffin Island and does not present a threat to spreading COVID-19 into Kitikmeot or Northwest Territories, I don't think it will put the travel bubble with Northwest Territories at risk, but I will obviously have to discuss that with Dr. Candola.
Dr. who?
Candola?
Gasuli. Tan nakasa yakko tusak tigiak kaw yakalo titira bigillugo nunat siya mitay maluta ngokatinga luta Candola. Tusak bigis mangita kiulaw masuli tan naluta na taw si tutillugo suli. Hikitalo mi tuniluta na isumalo na ngimmaman na yung siya magayak ningini. Kitir mi nunat siya mulunit. Amalu taman na ulah katigi kataon na nunat siya nunavullo katigit siya kaya kamnak takaluta Candola nalunak bigit siya lugo.
Thank you.